My name is Juhn. I am a faculty in the Department of Pediatrics and Director of a Pediatric Asthma Epidemiology Research Unit at Mayo Clinic. The result of our recent research work entitled "An Asthma and Proinflammatory Conditions," population-based retrospective matched cohort study will appear on October issue of Mayo Clinic Proceedings. The main aim of our study was to determine the association between asthma and the risk of pro-inflammatory conditions, including coronary heart disease, diabetes, rheumatoid arthritis, and inflammatory bowel disease. As a brief background, previously our research unit demonstrated a significantly increased risk of microbial infections, including serious pneumococcal disease, community-acquired pneumonia, whooping cough, strep pyogenes infection or throat infections, otitis media, and even the shingles among the asthmatic patients compared to non-asthmatic patients. So in these investigations, we extended our study to examine whether this is true for chronic conditions mentioned before. And the literature suggesting there are distinctive immune environments such as a Th1 predominant immune environment and Th2 predominant immune environment. These two particular immune environments, interestingly, have a counterbalancing relationship like a seesaw. One goes up, the other goes down, the other goes up, the other goes down. So therefore, we hypothesize that asthma as a Th2 predominant immune condition might reduce risk of pro-inflammatory conditions was associated with Th1 conditions. So we hypothesize asthma actually reduces risk of coronary heart disease, rheumatoid arthritis, and diabetes, and inflammatory bowel disease. And to address this study aim, we conducted a population-based retrospective study which followed about 2,400 asthmatic patients and 4,800 non-asthmatic patients, age and gender matched non-asthmatic patients between 1964 and 1983 in our Olmsted County, Minnesota. So the main outcome events of this study was risk of coronary heart disease and diabetes, rheumatoid arthritis, and inflammatory bowel disease. So what we found was that in contrast with our hypothesis, we found that asthma in fact increased risk of coronary heart disease and diabetes, but we did not find such association with inflammatory bowel disease and rheumatoid arthritis, primarily due to a limited sample size. Well, I believe this is a sort of a preliminary result that is subject to a confirmation of our study findings. In the meantime, clinicians, particularly clinicians who are taking care of an asthmatic patient, should consider assessment of a risk of coronary heart disease and diabetes be a routine part of asthma evaluation during their follow-up. That's clearly clinicians need to be aware of this. This is a rather new findings, so a lot of patients with an asthma out there may not aware of these potential associations. So for example, asthmatic patients tend to often experience some chest discomfort due to uncontrolled asthma symptoms like a cough or air inflammation. But given our study findings and a potential association between asthma and coronary heart disease, and patient may not just simply regard and chest discomfort as uncontrolled asthma symptoms, but there could be a serious manifestation of coronary heart disease. So they need to seek the medical attention, obviously. So we are thinking of three main approaches as a next step. First is to replicate original study findings in a new study. So we are actually right now launching a new study to confirm the disassociation. Particularly, we're looking at the association between asthma and risk of a coronary heart disease, primarily to address the limitations of the current study. That's our first step. The second step is the asthma actually shares underlying biological mechanism with other atopic conditions such as allergic rhinitis or hay fever and eczema, atopic dermatitis. So therefore, we hypothesize that if the association between asthma and risk of coronary heart disease and diabetes reflects some underlying inflammatory cause, we postulate that potentially other atopic conditions such as atopic dermatitis or eczema or allergic rhinitis or hay fever might be associated with increased risk of coronary heart disease or diabetes. This is a sort of our exploratory study. We try to look at the role of a previously known risk factor of coronary heart disease, for example, and hypertension, diabetes, and overweight in risk of coronary heart disease, whether that association can be modified by asthma status. So meaning asthma not only associated with independently with a risk of coronary heart disease, but they might modify even the association between known risk factor and coronary heart disease. But what the bottom line is this study is very preliminary in nature and is a subject of confirmation of this association. So first of all, the clinicians and patients need to be aware of potentially unrecognized this risk of coronary heart disease associated with asthma, and they need to carefully evaluate and monitor symptoms associated with coronary heart disease or diabetes. And for the researchers, first of all, that they need to replicate and confirm this study findings in the association between asthma with coronary heart disease and diabetes. Once they confirm that, then they need to investigate the mechanism underlying the association, first of all. And then they need to somehow come up with approaches to modify, to reduce the risk of coronary heart disease or diabetes among the patient with an asthma. So that's a sort of a bottom line take-home message, but larger work still need to be done. Thank you for the invitation.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.